because it's very difficult to talk from an abstract point and tell people you have to kill germs, you have to kill germs, you have to kill germs. Now when you come home and you say, I have COVID.
Dr. Munene to our health talk this evening, and maybe you can give us a little bit of a background about yourself and what you do and why you're here today.
Okay, thanks, Dr. Kariuki, for having me in this session. So my name is Dr. Daniella Munene. I am a pharmacist. I work for the Pharmaceutical Society of Kenya, where I'm the Chief Executive Officer. I'm also a wife and a mom, and I run a household of 5 people with several animals and a little bit of livestock.
Wow, okay. And I think I can look at your introduction in 2 parts, what you do and also other things that happen around you, around your home. And I think that's why we have you here today, because so many people are in situations where they are now COVID positive, or they have a COVID positive member in their family, and wondering now, we have all these MOH standards, we have all these MOH protocols, we've had so many things in the news, but what do I actually do? You know, when something now comes to you, start asking, oh, what did I hear? What do I do? So Daniella, I think you're in a good place to guide us, because with your permission, I know you did have COVID and recovered from COVID a while back, yeah? And maybe you can just guide us to what are some of the things you thought about setting up immediately you found that your test is positive?
Okay, so when I got my positive result, I looked back, to try and gauge how long I had been positive or where I had contracted the disease. So for me, it was quite easy, because I had only just come back home after travel 2 days before I got my result. And so regardless of when I contracted the virus, I knew I had only been with my family or my household for 2 days. And so the first thing that came to mind was who might I have infected in my home? And so, so I decided, testing is an expensive affair, because you pay out of pocket when you present yourself for testing. And so I decided to manage my costs, by assigning everybody a level of risk of exposure. So I had 2 members of my household who I closely interact with, in the house every day. So I thought these are the high risk group. The other 2 members of my household, we don't interact much. We might not even share a table. We might not even, come into physical contact at all in a 24-hour period. So I put those 2 in category B, lower risk. So I said, here's how I'm going to manage my costs based on the risk. So I sent category 1 for testing. But obviously, this was after I isolated myself from everybody, and I'll talk about isolation later. Okay. And so I sent the first 2 for testing, and I said, if these ones are positive, then I will cascade testing to the other category. That's how I dealt with it.
Oh, wow, that's a very good point you bring up, because, it is quite a cost, depending on how many members live in your house, how many people you are with. So that's a good strategy to be able to also manage costs, and not just, as I've heard people say, use all the money for testing and then what will you use for treatment, right? Okay.
Exactly.
So you tested category A first?
Yes.
Okay.
Yes.
And how did that go? And how did that help you in making decisions around what you do next?
Right. So as I had mentioned, I had already isolated myself from everybody because at this point I'm the only known positive. So I need to just assume the rest are negative, and I don't want to infect them. So then category A went for their test. And while we were waiting for the test, we were completely separate from each other. And both their tests came negative. And so I said, then what's the probability that category B is positive, and we hardly interact? So I didn't send anybody else in my house for test, but I said category C will be any of these 4 people who now develop symptoms. So I'll just watch out for symptoms, and then those will be the next people that will go for test, including category A if at all they develop symptoms later on. Because obviously there's that incubation period. So you really don't know if they're exposed, will they become positive, after a few days. And so at that point, I stopped testing and I just started monitoring them remotely for symptoms.
Okay.
And so the plan was that if anybody is positive, they will join me in my isolation. And then so we'll have all the positive people isolating on one side of the house and the negative ones on the other side of the house.
Okay.
But it turned out I was the only positive one. So I just continued my isolation for 10 days while everybody else used the rest of the house. And nobody became symptomatic. So thankfully, I didn't need to send anyone for testing.
I've had people asking the question, for example, is if I have a small child and my house help or my other children are positive, can I, the negative one, isolate and let the other people move around the house? So I think you're also clarifying that the positive one is the one who isolated, and the negative people are the ones who use the rest of the house, right?
Yes, that's actually more convenient because the negative people then have control over disinfection, decontamination, the dishes that you handle, the items of clothing that you handle. If it was the other way around, then it would be very difficult to keep the negative person in isolation away from food that's not contaminated, and items of clothing and laundry that's not contaminated.
Okay, so now, some things we don't really plan for. For example, you're the mom of the house, and many of the moms are I like to call us people in operations, finding out what happens, giving directions to everybody. But now you're the one in isolation. How did you set an isolation system from isolation? Maybe you can guide another mom who's wondering how to do that. What instructions did you give? How did you manage the whole scenario,
That's a very good question because, exactly what you've said. As soon as I got my positive result, the first thing was, how do I organize my household without me actually running, practically the household, because I'll be in isolation for the next almost 2 weeks. So the first thing that came to mind is supplies. What supplies do we need? And who can I send to deliver those supplies to our home? Because at this point, I can't dash to the supermarket. Number 2, how do I give instructions to the person who manages the everyday cleaning and cooking and work in the house in such a way that they don't need to have contact with me as much as before? Also, number 3, how do I reassure the people in the home that they are okay and they're safe, and that things are okay and they're under control? Because a little bit of anxiety creeps in. And also depending on the level of knowledge that people in your home have about COVID. So the first instruction I gave, I gave particularly the lady who was going to be serving me my food, and she's the one who cleans. I told her she needs to be sanitizing all frequently touched surfaces, and I gave her the disinfectant to do that. Secondly, I told her when she comes near me to bring me my food or whatever it is she needs to serve me with, she needs to have her mask on, and she needs to stay away from me. We organize a system where she places something on a stool outside the room where I was. She knocks on the door, and then I open and come and get it. And then I reassured her that without me being in the rest of the house, you don't have to wear your mask. You just need to just keep sanitizing. As long as you stay away from me, you'll be good. And so thankfully, we have phones and we have Wi-Fi. I mean, we're able to talk even on WhatsApp and other platforms. So I maintained communication with everybody in the house, and the person who was serving me my food, and even I instructed her how to wash my clothes and handle my clothes, that my clothes will not go in the usual dirty clothes basket as everybody else's.
Yeah.
I told her as long as my clothes are washed with soap and water, they should be okay. Actually, it was more of reassuring her, because suddenly she felt like a little bit at risk in this household with a COVID positive person.
And I know it's so natural. So Daniella, I know you're a pharmacist, and a lot of the times, even as we put down protocols as healthcare professionals, we just put down, so make a JIC concentration of 0.35%. I mean, how do you communicate that now in a practical sense, that somebody knows what to do? Do I use the same 0.35% for my clothes? Is it the same concentration for my dishes? How did you guide your household around that? What do they do? How do they mix? When do they dispose? Those things we don't say in the guideline. Just assume, well, somehow people will know.
Well, I'll start with the decontamination solution. I'll start with the concentration that is needed. We need a 0.5% sodium hypochlorite solution. So what I did, because I know the JIC, the household bleaches that we buy for our homes come already in a concentration of 3.5%. And so I just need to dilute that 7 times, to get 0.5%. So literally I took a spray bottle, and luckily I had some spray bottles because the pandemic had begun, and, we already had a mild decontamination system or procedure, but now I wanted to really tell her, you need to observe this one. So I took the bottle, I mentally assessed, I divided the bottle into 7 parts. And so I told her, you put household bleach up to here and you top it up with water. And then every day you spray it on door handles, you spray it on surfaces, and wipe it down with a cloth, and only dilute it in this small bottle, because I know that sodium hypochlorite eventually, because of exposure to light and air, it becomes inactive. So I told her, you keep doing it, and you keep once it's empty, refilling. And I told her to sanitize surfaces 3 times a day. Okay. And so that's a system she got into. And that way she was even getting educated about frequently touched surfaces, because I told her the fridge handle, the microwave handle, the kitchen counter, the dining table, the door handles, and that's what she did. So with household bleach, you dilute it, 1 part household bleach to 6 parts of water. You should hit that magic number of 0.5%.
And that was the same for was that the same for dishes that came from you? Or were they disinfected at all? Were there any instructions around that at all?
The instructions around my clothes were just to store them and wash them separately. And the instructions around my dishes were just to wash them with soap and water, also separately, because soap and water is adequate to inactivate the virus.
Okay, and now, so you stayed at home in isolation for a number of days. Now, how are you looking after the rest of the family? Yes, they did a test at the time of just after you got confirmation of your results. How about in the days following? Were there any measures you put in place to, see if they have the symptoms you talked about? And how was that being managed with you being in isolation? Were there apps you used? It's a digital world. There's a lot available.
Yes, I can imagine. Thankfully, my youngest is already a preteen, so it wasn't very difficult. So I would just be able to ask them whether it's across the door, the closed door, or through my phone. I would ask them how they're feeling. And because there was another adult in the house, then he also knew that, that I'm watching out for symptoms and that he should report to me if anybody in the household has a fever or starts coughing, flu-like symptoms. Actually, Beatrice, the aspect we don't anticipate the most, especially if we're thinking about the technical details, is just the reassurance of the family. That was actually the biggest need, because my daughter she told me she was actually hoping she would be positive so she can join me in isolation, because I had traveled prior to my diagnosis, and then here I am, I'm back home, and I'm away from her. And so that's a different level of management from managing those ones who are afraid of the disease. This one just wants to be with mommy, And so and then because I was almost asymptomatic. I had very mild symptoms. So she's not understanding, mommy sounds fine. And then she's saying I can't enter her room. So, I mean, what is all this about? So that was I really had to explain to her the reason I'm doing this. And that was actually harder than any technical thing that I had to do, because she just wanted to be with me in the room.
I can imagine, because she can see you're not sick per se, you're infected, right? But you're not sick. So, and you're telling her, I can make you sick, and she doesn't understand how will you make me sick and you're not sick, right?
Exactly.
Yeah.
The other thing I must mention is I wasn't really in contact with my immediate household. I realized I had been in contact with my mom during the 2-day period when I could have exposed people. And so I also then, thankfully, she was the only one outside of my household who was a close contact. So I also alerted her about my status so that she can go and test. So she opted not to test, but I gave her all the information and told her I recommend, because of the amount of time we spent together in the same vehicle, shopping together a whole morning, please go and test. So at that point, she refused to test. And so again, you weigh, should I really insist that she test? But she was asymptomatic by that time. So she was another person that I kept monitoring on phone, how she's doing, because at the first sign of symptoms, I would have insisted that she now must test. And you see, at that, like for my mom, she was afraid. She just got afraid of going for the test. So had she become symptomatic, I would have had to deal with that fear, because I would have insisted that she tests. So I think from my own experience, and everybody's experience is different, the bit about reassuring people and managing fears and anxieties, and the separation anxiety of children, that was actually harder for me than the actual decontamination and separation of items and all that.
Oh, wow. Thank you, Daniella, for bringing that up, because I know as we write protocols and guidelines, sometimes there are some things we cannot anticipate or imagine. So that I'm sure is going to help a mom or a parent somewhere who's also wondering how to manage some things. Okay, so the last thing is maybe how did you communicate to other people, probably your colleagues or other places where you have engagements, about your results and your need to isolate for a number of days? And what kind of reactions did you get from people once you did share the information?
Well, it's interesting. So I did share with all colleagues that I had active work going on with, just for them to know. And it was a mixture. Some people, feel very sorry and they're very symptomatic. They ask, what can we do? Thankfully, because I was asymptomatic, I was able to continue working even in my isolation room. But I remember there was a colleague who said, really, these tests are fake. You must go for another test. It could be negative, and then you can go ahead and travel, because I had other travel lined up. And so, people take these tests differently. And so I thought to myself, I know how this PCR tests behave. If I go for another test that may not be as sensitive, it may miss the COVID. And then I jump on the plane and go somewhere. And by that time, my viral load is high. I test positive in that country. I'm not going anywhere. I'm giving myself 10 days. I want to be sure I'm negative before I go anywhere. So it's a mixture, and it all depends on people's perspective on how serious coronavirus disease is, and how much you can trust the system. So at the end of the day, you have to make your own, based on the facts that you have to create your own course of action, because there are those people who felt there's no need for me to isolate, there's no need for me to stop working. I just need to find a lab that will give me a negative result, and I move on with my life, and I work and I travel.
Once you shared, are there people who also reached out? You know how Kenyans sometimes we're afraid to share some things because of judgment. Are there people who reached out and, you know, also surprised you in their response?
That's a very interesting question, because it was early days, you know, when some people would say they're positive and some would not say. There was still a cloud, you know, associated with being COVID positive. And so when I did, in some of my professional groups, when I did say that I've been diagnosed with COVID, some people, you know, who had never told me that they had had COVID before, they came out on the group, you know, like, for example, a WhatsApp group. And they say, oh, even I had COVID a month ago. In fact, somebody told me I've had COVID twice this year, you know. And so I realized it's good to talk about it, because you get people out of the woodworks to also say, and that also gives you a sense that this thing is more prevalent, you know, than you probably think. So that definitely did happen.
Okay. Some closing comments from you?
Just also advise, especially, you know, women who run homes, that you need to also reach out to your, you know, to people, and, you know, for help. Because I imagined if I didn't have enough groceries at that time, I would have needed someone to help me shop and deliver. If you have a friend who has a small baby, for instance, the baby is negative, the mother is positive, such people need a lot of help in terms of logistical issues. And so these days, every time a friend of mine, you know, tests positive, I'm very quick to offer, I'll do a grocery run for you. Just those little things.
Thank you so much for speaking with me today. As you know, I know we both share the passion of educating and creating awareness around important and practical issues that empower patients to make decisions. And I hope through this, the different pieces of information and how you shared the decisions that you had to make and how you made them will guide somebody in making the right choices for their family, or making the practical choices for their family.